beat like 1, 2, 3. It's you and me, you and me. 2 hearts beat like 1, 2, 3. It's you and me, it's you and me.
Hi there, and welcome to Inside the Heart of Trent Memorial Hospital Foundation July show. Today we are talking about ophthalmology and at Trent Memorial Hospital, and with me is Dr. Sakamoto. Thank you so much for coming today.
Thank you for having me here.
We really appreciate it, you taking time out of your busy day. So what do you do here at Trent Hospital?
At the hospital itself, mostly in the operating room with cataract surgeries. Occasionally we do laser days, clinic days here as well.
Oh wow, wow. So how long have you been an ophthalmologist and worked here with Quinte Health and at Trenton Hospital?
Quinte Health, I started beginning of '95, so
Wow.
we're talking 28 years plus.
Lots of experience, lots of good experience. We're lucky to have you. And Trenton, how long have you been here? Or I guess the same, yeah,
Same length of time.
Great. So what do you like about working here?
In Trenton itself, it's been good because we're kind of like one of the major services here because we don't have any ophthalmology services in Belleville
Okay.
for the operating room.
So are we the only hospital in Trenton Hospital that does cataracts then?
In our
Surgeries?
area
Wow.
for our corporation.
Wow,
yes.
so that's a big catchment. That's a lot of people that come
Yeah.
here.
So all of our ophthalmology is done here. We do see some patients at the Belleville Hospital, inpatients if needed, but other than that, everything is done either at our own offices or at the Trenton
Or
Hospital.
at the Trenton Hospital. That's amazing. So what procedures are done here? I know you talked about cataracts. What
So
are-
mainly in the OR, we're doing cataract surgeries.
Okay.
We do have a corneal specialist, Dr. Gupta, who's come in the last year,
Wow.
and he's trying to do some corneal procedures as well,
Wow.
Either in the clinic or in the operating room.
Okay.
So that kind of adds a little bit to what we do.
Yep.
In the day clinics or in the clinic area, sometimes we'll do some lid procedures and mostly very small
Sure.
surgical things.
And most are day surgeries, right? So people are in and out.
They're coming in the morning or in the afternoon
Yep.
and they're gone
That's-
2 or 3 hours later.
Wow. What an advancement in technology.
Yes.
How many patients would you say that you see in a week or a year?
In the office?
Yeah,
In
or
the office-
cataract surgeries?
Yeah,
or,
in the office
yeah.
and the clinic and the cataract surgeries, probably about around 150 patients a week.
Wow.
Combined.
Yep.
For cataract surgeries, we're probably talking about 500 plus cataract surgeries per year for each one of the surgeons who's
Wow.
here.
That's a lot of people. So equipment, the most up-to-date equipment is so important, I'm assuming, for what you do.
Yes. And in the OR, we've been fortunate to have the one of the better phacoemulsification machines that we bought. Must be 5-6 years ago.
wow.
Again,
Yep.
with help from the
From
foundation.
the foundation, that's great.
And then the provincial government actually funded us for another second set of
That's
equipment,
great.
which includes the phacoemulsification machine and the very important microscope as well.
Wow. So what other types of equipment is needed that maybe you're still needing or that you're looking for in your department?
Mostly it's for the cataract surgeries, it's the phaco and the microscope, but it's also the instrument trays as well.
Okay.
Because the more instrument trays we have, the better turnover we can have with regards to cataract surgery patients during a single day.
Oh, we're so lucky to have you in the area and to have this department, and we just thank you so much for taking the time today to meet with me and to take part in Inside the Heart of the Hospital Foundation.
Like 1, 2, 3. It's you and me, it's you and me.
Welcome back to Inside the Heart of TMHF. Joining me today is Dave Shoniker. Dave, thank you so much for joining us. You're a community guy that most people around town know, and we're happy to have you join us today.
Well, thank you, Wendy. It's nice to be here.
Yeah, well, we wanted to invite you in to join us today because we know that you've used the hospital, unfortunately, but you've had a good experience in those times that you have needed us. And so I wanted to bring you in today to talk a little bit about that, if you can just share with us, the times that you've used it.
Well, the times that I've used it, I did have a heart attack a number of years back, and the hospital was really, really good there. I came in, they checked me out, and within a couple hours I was headed to Kingston, so I really appreciated that. But other than that, day surgery is one of the things that I tend to be using up here a lot. And I had cataracts, or I'm sorry, I had carpal tunnel on my wrists done, and Dr. Science did that. We did it here in day surgery. It was a breeze. It was a real breeze. And then the last thing that I had done was cataracts to both eyes, and from the walk in the front door, Wendy, to admit, to pre-op, to laying right on the stretcher to go in for surgery, it was just seamless. You know, the staff was really good. They were informative. They made sure that I was well aware of what was going to happen and what was going to, you know, what was coming up next. You just, you know, if you have good people working here, looking after you, it just puts you at ease, and it really works.
Absolutely. And the thing is that you can't get the good staff if you don't have the good equipment,
No.
right? And so when you came in from pre-registration through, you know, in pre-op, you had to have your vital signs checked.
Correct.
That's funded by the foundation. You were on a stretcher. It's funded by the foundation. You went in and had your cataracts done. The anesthesia equipment, the microscope, the lasers, the diamond knives they need to do the cataract removal, all funded by the foundation. Again, the equipment when you come out into recovery, people don't realize the actual cost of that one procedure just in the equipment alone. And you know, we don't get the ophthalmologists and the nurses and all this, the technical staff, clinical staff coming without that good equipment. And so it all kind of goes full circle, right? If you want the very best patient care, you have to have the very best equipment to get the very best staff.
It just, you know, to have the equipment in here to do the procedures, it just it's a win-win situation.
That's right.
1, 2, 3.